Any wound that's not healing, they need to come to a specialist or to come to the center where this is all we do on a daily basis. There's various reasons for wounds not healing, but typically the wound needs to be clean. It needs to be free from infection, and we need to keep a moist environment for healing. The body does the healing, we just assist it. One of the first things that we need to know when you come into the center, especially if your wound is on your extremities, in fact, mainly if it's on your extremities, your feet, we need to know that you have adequate blood flow. So we typically will check a blood pressure in your leg and compare it to your arm. If it's equal, then we're okay. If it's much lower in your leg than it is your arm, we have got to have adequate blood flow for proper healing, and we need that blood flow. So thank God we've got Oklahoma Heart, and they've got some wonderful technology and cardiologists that can actually get all the way down to the toes almost and restore flow to that foot, which is something we didn't have in the past. So we feel really good about having that relationship, and with their expertise and everything, it really helps us because we've got to get those patients vascularized to get them healed. So that's a challenge. So we need to know we have blood flow, and then we assess for signs of infection. But typically, we do the same thing with everybody. We clean the wound and we keep a moist environment and make sure they have adequate protein. We need the nutritional status. The 5-year mortality after a below-the-knee amputation is greater than colon cancer, breast cancer, and prostate cancer combined. The chances of that patient being alive in 5 years after they've had a below-the-knee amputation is less than if you had all 3 of those cancers together. So we can't always prevent amputation. There are some times, but we tend to turn to that too soon. And we're trying to stop that. And that's why, we need to get these wounds as quickly as possible. A wound is considered chronic when it hasn't healed in 30 days. Any wound that's open for 30 days is considered chronic. Now, typically, if you're making good progress and it's close to healing, and it's probably okay. But in 30 days, it's considered chronic. So, and it's considered an ulcer at that point. So, usually the body's pretty good at this healing. So, there's something wrong, and somebody needs to address that. And typically, this is our expertise. I'm amazed on a daily basis how the body can just heal a wound. It knows when to start healing, it knows when to stop healing. So it knows when to stop this process. So, uncontrolled cell growth is cancer, but your body knows to shut this process down whenever it comes together. It's fascinating. And sometimes you can't even tell where the wound was. So I see this on a daily basis. So to me, I'm fascinated every day. So it's pretty amazing how the body can do this. So, but sometimes it needs our help. We have been awarded 5 years in a row a Center of Excellence compared to other wound centers of our size across the country. We have a 98% patient satisfaction rate. As I said, a lot of that has to do with our staff. So you become family when you're here, and sometimes these wounds take a little while. So. It's very rewarding to help these patients, help them with their pain, help them, prevent amputation, and just help them with a better quality of life, because these can be quite painful, debilitating in the hospital repeatedly with infection. So wound centers can help prevent that. They can keep people out of the hospital. Very seldom do our patients have to go to the hospital for their wounds, because we're monitoring them on a weekly basis, and as long as they're communicating with us, we can prevent that. So I just feel like we play a critical role in healthcare.